So many familiar faces. This is awesome. Welcome everybody to our, this is November? Yeah, gosh, this is November already. November MOPA Roundtable for Integrated Care. I really appreciate everybody being here. I'm going to go over some housekeeping and then I'm going to hand it off and let Mandy Williams and Megan Steen introduce themselves and take away this roundtable. So remember, this is a discussion and not a seminar. It's interactive discussion format. Please feel free to interact with our panelists at any point. More discussion is better. You can turn your camera on and off and your audio on and off as necessary. If you don't mute yourself and your room gets loud, we may mute you. We are recording, and so this could be used by future use of MOPA. And I want to be very clear that the opinions here that are expressed do not necessarily represent the views of any of the Missouri Psychological Association. They are our own. For Category A, CE credits, make sure you're signed in with your full name in order for us to track your attendance. And then you will get a PDF attachment if you're a MOPA member within a business day. Otherwise, let them know if you'd like any documentation. You can email support@mopaonline.org. All right, well, I'm going to hand it over to Mandy and Megan. Mandy, if you don't introduce yourself and then pass to Megan, and then we will get started. Thank you so much for being here.
Yeah, so my name is Mandy Williams, and I am an intern at the OBGYN clinic in Bothwell. I have lots of experience working within the perinatal period. I did a practicum at Children's Mercy NICU for a year, and then have done the developmental and behavioral clinic there as well. So lots of experience there, and I'm excited to chat with you all and discuss more.
And my name is Megan Steen. I work at Burrell Behavioral Health. I am a licensed clinical social worker, and also have really just become really passionate around perinatal mental health and have gotten involved with Postpartum Support International. So I actually sit on their Missouri board chapter. But also kind of through trainings that I had the opportunity to participate in with Postpartum Support International. I actually went through and got my certification for perinatal mental health as a certified mental health professional for perinatal mental health as well. So looking forward to the conversation today. And so I can just kind of jump in about one of the ways that I really became passionate around mental health. For me, it was kind of a personal thing that sparked my interest was, kind of watching many women in my life, and that I was, maybe working with either professionally or in my personal life, kind of navigate, the experience of motherhood and pregnancy loss as well. And then kind of going through that experience personally, it opened my eyes through a different lens of seeing how many opportunities there really are through that process where women can really fall through the cracks. And so, if a new mother doesn't know some of the right questions to ask or have some of those support systems in place or know where the resources are, it can really be detrimental not only to mom, but also baby and the entire family system. And so, especially when we think about, from a physical health perspective of pregnancy, every new mom is screened for gestational diabetes. And we know that it's a very small percentage of mothers who are impacted by gestational diabetes. However, we know that the statistics are overwhelming of the number of new moms who are impacted by depression during pregnancy and during the perinatal period. In fact, we know that approximately 1 in 13 women experience a new onset of depression during pregnancy. And yet that is something that is inconsistently screened for. And when you often talk with providers, the reason that they do not screen is that they don't always know the next step of where to refer as well.
Yeah, and I think that you said it perfectly, not knowing the questions to ask or even what all the symptoms are. I think that in terms of general depression, we're aware of the symptoms in the mental health field, but it can look different postpartum. And, postpartum depression may be a little bit more well known, but there's all sorts of other mental health experiences and disorders that can happen, including anxiety, OCD, PTSD. And I became kind of passionate about this area after my experience in the NICU, because as I sort of became integrated there, I realized that it's a really new field and that it was just an area that just makes so much sense to have psychology integrated in. There's all of these traumatic experiences, and yet many NICUs don't have psychology integrated, and parents are just kind of expected to reach out for that support. So I'm curious if anybody else has any sort of experience working with mental health in the perinatal period. So I saw Mark shake his head no, and I'm guessing that there's not many others that have a ton of experience. You might have had a person or two come across, but like I said, it's a relatively new field. Has anybody heard of PMADs before, or postpartum mood and anxiety disorders?
Oh. Jennifer, I think that I can hear you, or I can see that you're saying something.
And Amanda and Megan, there were actually a comment in the chat that only because I had a baby and it was mentioned in the breastfeeding support group. So.
Yeah, and I echo what Megan's saying there, that I love that it's being brought up. Currently being in an OBGYN clinic, I think we'd like to think that it's being screened at every postpartum appointment, but unfortunately that's not always happening. So there are a lot of new parents that are falling through those cracks.
One of the other things that we see, and why it's so important, and I love to hear that some of these support groups are starting to have these conversations, is that it can be a really uncomfortable topic to talk about because of the way that oftentimes society portrays motherhood. And so oftentimes there are a lot of society expectations that are placed on new moms and new families, that this is a magical time of life, or that, it's just expected that you would be tired, or expected that there would be some struggles. And where there really becomes that difficulty is when there's that conflicting message, and then new moms and their support systems may not always know what is the difference between kind of the normal struggle of postpartum compared to when we're past, when it's starting to really impact mom and family. And Amanda, I don't know if anyone else has seen that as well too, just how difficult some of those first conversations can be with
Yeah, I definitely think that I have for sure seen the struggle for moms to not want to even bring it up, which is why those screeners are so important. Or I have this, so there's two different screeners that we use here. There's the Edinburgh Postnatal Depression Scale, which is just 10 items, and they go through and score that. It really should be given every time a mom comes in postpartum at the 1 month checkup. And the other thing that we started doing is this perinatal mental health discussion toolkit, which has a bunch of checklist items on there to look at symptoms of OCD, anxiety, depression. And I think like it's a really important way to be able to assess for those things, because a lot of times moms are scared to bring that up. They're worried that they're going to be looked at as a bad mom, or even that potentially their baby could be taken away because they are dealing with this. And so I think oftentimes providers think, oh, well, you know, if they're struggling, they'll bring it up to me, but that's not usually the case. Yeah, and I think I see the question here about the screening strategies. I definitely recommend at the 1 month checkup that there should be screenings in. I wish that we could have it more often than that, but that's at least a great way to get started. And you know, I hear the doctor asking a single question, or like, are you feeling depressed? Are you feeling anxious? And then a lot of times it's like, well, no. And those same questions have been asked by providers, and then these checklists are given out, and we get a completely different picture, because the symptoms that somebody could experience, they may not understand the full picture of how that relates to depression or anxiety.
And I'll just touch on the comment that was in the chat as well around the pediatrician doing the screening tool. And I'm being told that my internet connection is unstable, so I'm going to turn off my video for a minute to see if that helps. Okay. And that oftentimes the difficulty, just like you said, to where, is that better now? Okay. The difficulty can be that it's not necessarily explained what's happening with those tools and what the follow-up will be, as well as that that's not necessarily a provider that mom or family have a connection with yet. And so this may be the first appointment to where they're meeting the pediatrician for the first time. And so there's no other baseline or history, nor is it mom's provider who necessarily has the baseline of being able to follow up.
And I think that, sorry, go ahead.
I was gonna say, I work in a pediatrician's office where we do screening, but then some of the things that come up as challenging is our patients are the kids. And so oftentimes we don't have like the full like parent in the medical record or the parent's insurance and things like that. So even if they do screen positive, there's a conversation about community resources, but we can't necessarily provide those in the pediatric office. And so that's one of the challenges that we talk about a lot as a team is how are we supposed to manage these? How do we get them connected with the resources that they need when we don't house it here?
I think that's definitely a great point. I was fortunate in that when I was at Children's Mercy in the NICU, it was all billed as related to the baby. You know, in order to support the baby's well-being, the parents had to be thriving as well. And so I'm not exactly sure how they worked that out there, but fortunately that was able to be done that way. I think it gets a little bit more complicated as the kiddo gets a little bit older or in a pediatrician office, where you may not be able to get them the services right then and there for that. Which again, I think it's wonderful that they're screening at the pediatrician office and figuring out, okay, what do we do when there is something significant on there?
And Amanda, just a quick heads up, Megan's having a little bit of trouble, so she'll be back on in a second.
No worries. So I'm curious how many people, okay, so we talked a little bit about the mood and anxiety disorders. How many people are aware of postpartum OCD, PTSD, bipolar?
In progress.
I saw one kind of head nod. Okay, and a thumbs up. I think for me personally, until really even last night, I was looking at the numbers. I was not aware of like the rate at which PTSD is experienced following childbirth. And the statistics show that like 9% experience PTSD following childbirth, and it can happen from things like prolapsed cord, an unplanned C-section, the baby going to the NICU, or really any of the birthing experiences. So that's also something really important to think about when we're evaluating is, okay, are we asking about how their delivery and birthing experience was?
Absolutely. And one of the important things to also be thinking about, and I apologize if you talked about this when I was kicked off for a minute too, is also around pregnancy loss, and so factoring in the trauma that is experienced there. And so sometimes when we talk about how many births have there been, but it's also important to understand how many pregnancies there's been, so that we're asking the right questions to find out about the experience that mom has had in the past as well.
And I think going off of that, kind of breaking that stigma around that, because I think a lot of times we think that having a baby is supposed to be this beautiful experience, and for a lot of women, it's not. So when we have this idea that that's how it's supposed to be, or going in and saying, congratulations to somebody that's expecting, and they're having conflicting emotions around that, or they've previously had multiple losses, that can be further the barriers for them getting the support that they need.
And I saw a comment around, kind of talking about the pregnant and in pregnancy and infancy loss. And it adds complication to an already complicated perinatal period. People feel uncomfortable talking about, but if we're not, if we're not the ones to feel comfortable having those conversations with mom and families, there may be no one else who's able to have those conversations. Also around the topic of birth trauma, I think, from my understanding, it will be years until we really see the impact and the data around women who delivered alone and under very traumatic circumstances during COVID-19. Think of how many restrictions were placed on hospitals, how many new mothers were delivering possibly while they were unconscious with COVID themselves, and what that experience and the impact that it had on moms, families, and then postpartum, what that looked like during a time to where, sometimes, individuals are lucky enough to have individuals rally around them for support. And that was really a time period where that support was non-existent for many families. And so during a time that can already feel isolating, being further isolated, and knowing that the impact of that we will be seeing for years to come. And maybe, I don't know if any of you are already starting to see the impact of some of that in your experiences and have anything that you'd like to share or add in too.
So the period that I was in the NICU was actually, the pandemic started March, and that following fall was when I was in the NICU. So I saw a lot of moms talking about having to give birth alone. And then you add to it the trauma of having your baby taken to a NICU and needing life-saving measures and all of that. We know that social support is a protective factor, but what happens when even the immediate support is taken away from you?
I know I worked with some women who talked a lot during that, especially that pandemic period, about just kind of grief around what they expected their pregnancy experience to be like and what it was like. Because I think we always have expectations that don't quite meet reality, but especially complicated by that COVID experience. I've worked with a number of women who talk about that they expected their partner to be at appointments with them and they weren't allowed to be. And they expected to have certain procedures in place when they went to the hospital to deliver, and it ended up looking very different than that. And so there was a lot of, beyond typical birth trauma, there was a lot of that experience about, man, this is not at all what I anticipated this experience to be like.
Yeah, I definitely heard a lot of that as well. And even just going in and having a COVID test the second you go in and wearing a mask while giving birth. And I had moms and dads who tested positive and then weren't allowed to be around their baby for that period. I think exactly like you said, that the grief of this experience is not what I thought it was going to be.
I will say I had a baby during COVID. And then I also I have my second is 4 months old. And I think it's interesting, kind of some of the grief that I'm experiencing now, because I didn't realize then what I had missed out on. And so there's so much support now. So with my first, we were not successful in nursing. And there just weren't any resources that were readily available because all of the support groups were down and all of the, it was just, even the lactation consultants and things like that. It was very hard to be able to get appointments and be able to do those things because everything was still shut down pretty substantially. And that wasn't seen as necessarily a high priority. And so at the time, I just exclusively pumped and that was fine, whatever. But now seeing what I had missed, and having that support and being able to be more successful and things like that, it's very bittersweet. And so I don't know if we, you may see lasting, trauma and impacts from those births, but also as, these women are having their second children and having different experiences, we may see some of that sadness come up.
Hannah, that's an amazing, thank you for sharing that. That's a really significant point, and something that that you're absolutely right for these experiences. And, you know, there are women that I've talked with where, you know, postpartum depression or anxiety or even psychosis really impacted their first experience. And then they were able to seek treatment. And then again, that grief that you're talking about, and that bittersweetness of their second experience and how different it looks because they know different and they're doing different. But looking back at that first experience and how different it is the second time around, and kind of that exactly what you spoke to, of feeling like this is what I lost the first time, and almost experiencing that grief of you know, what could have been the first time too.
Do you all find that moms tend to kind of blame themselves, so to speak, if any part of the pregnancy or birthing experience does not go as planned, almost like they have failed in a way, failed in the traditional role of being a woman, or specifically a mother?
I can kind of speak to the research and things that I've read, and the things that the experiences that I and women that I've worked with through PSI is that, yes, you know, that overwhelmingly that is a guilt and a ownership that moms tend to take on themselves, as that they're, and that they are somehow failing their children by these experiences early on. And so that has just been what I have, you know, gathered in the research and experience. But definitely, Amanda, if you've had other experiences too and want to speak to that.
Yeah, I think echoing what you've said, I don't think that I worked with a single mom that had their baby in the NICU that didn't experience this feeling of guilt, even if they, you know, cognitively know that, like, there's nothing I could have done to change this. There's always the what if I hadn't gone on that walk? What if I had gone in sooner? What if I had done this or that? There's just always that kind of echoing in their mind.
I think that cognitive piece is really important too. I don't know if anyone has touched on yet around, you know, it's the rarest form of a postpartum experience, but postpartum psychosis, to where, you know, when we're thinking about screening for that, and we're thinking about, you know, that is really the diagnosis that is it puts mom and baby most at risk during that period. But that even during mothers who experience that piece of things, or that diagnosis, are believing that, you know, that it is still the focus of the baby, and that they are still trying to do what's right for the baby, even if we know that the hallucinations and things have gotten to a place to where it actually puts mom and baby more at risk. And so when you think about, you know, screening and the questions that we're asking around postpartum psychosis, it's being really specific around some of those normal questions that we may ask about sleep. But really the difference in the questions that we're asking is whether mom is feeling like she doesn't need the sleep. Because when a mom is experiencing postpartum psychosis, is not sleeping oftentimes, but is really not feeling tired, and is not aware that what they're experiencing is outside of the norm. And so when we're thinking about kind of teasing out some of those diagnoses with psychosis and anxiety, it's really that awareness piece of, is mom aware that the thoughts that she's having are scary, that the sleep that she's not getting is impacting her, or is there a lack of awareness that these are scary thoughts that she's afraid are going to happen, and that you know, she knows she's not sleeping and she's really tired too.
Yeah, I think that awareness piece is huge, even thinking about things like OCD. You know, we know that those thoughts can happen, but a lot of times with OCD compared to psychosis, there's that lack of desire to act on those thoughts. It's the intrusive thoughts coming, and then mom may start doing things to try and prevent that from happening versus recognizing that those are unwanted or scary thoughts.
Ooh, this is Andy from St. Louis. One thing that occurs to me is that the onset of the postpartum bipolar psychosis and even depression and anxiety is occurring at a time for many women who are having children, maybe in their mid to late 20s, that the natural onset of the chronic illness might also be occurring. So I imagine it might be difficult to tease out, is this postpartum, or was the birthing experience the trigger for a more chronic onset that we're now going to have to look at from a more developmental perspective? And I imagine at the beginning that would be difficult to assess.
That's a great point. And I think that one of the risk factors that is specifically with psychosis that we can be looking for is that if we know that a mom has already been diagnosed with bipolar disorder, we know that comes with a higher risk factor for postpartum psychosis. And so you're absolutely right. You know, it can be difficult to tease out with some of the onset, and if there are diagnoses that we know going into the perinatal and postpartum periods that we can be aware of, you know, that's really essential.
And I think that's a great reason why it's also important to be screening during pregnancy as well, which is something that we have tried to implement here. If nothing else, because it gives us a great starting off point of where they were at before. And we know that these things can also occur while mom is still pregnant. And the earlier we are able to evaluate this and set up some support and interventions, the better.
One of the things that I'm thinking about is how very treatable, you know, depression is, and even psychosis, postpartum psychosis. I mean, those are things that don't necessarily tend to come and then that last forever. So, Mandy, I know you mentioned earlier kind of bias and stigma. And so I'm kind of curious about the role of maybe psychoeducation, you know, of normalizing some of these things that might feel really highly unusual for some people, to let them know, again, that it's okay to talk about it, because there are things that can be done other than just like, this is how it is and this is how it's going to be, and somebody's going to take baby, so to speak. And that, I guess that also makes me wonder, you know, in the past, so to speak, we used to, and even in this conversation today, we're talking specifically about pregnancy, postpartum, you know, that mom is the pregnant one, mom is the one having the baby. And these days we use different language often in terms of both mom and dad, or dads or moms, or, you know, whatever the family system may look like, and what is the role, or is there a role for, I'm just going to use a heterosexual example, relationship example in this point, like a father to be educated, involved, screened. How would that fit in? Or does it fit in?
I don't know about with you, Megan, but I know personally here that is an area that is lacking and could definitely use more development, is screening for the other parent as well. In my previous role, we would call and evaluate and speak with both parents because we know that support for both parents or whoever is involved, whatever role it looks like, is really important. And especially, when we're thinking of the NICU and the trauma that can happen there, I saw both parents experiencing that. That's not just something that's limited to the birthing parent. It's watching your child in this experience, and sometimes even watching your partner go through a really traumatic experience. So there's definitely a need for additional support for other parents.
Absolutely. And Mandy, you bring up a great point. No, there is not enough screening or conversations that are generally happening with the non-birthing parent. And there are resources out there though. And so, one of the things that, I'm hopeful about with today is, especially like with the Postpartum Support International resources, that is something to where they do have non-birthing parent resources that are available either in the form of support groups or, just additional resources for them to access as well. Because oftentimes it's not discussed, and they are kind of the unspoken one at a lot of those appointments and experiences.
Thank you for that language. I couldn't quite, non-birthing parent, I couldn't quite, I'm coming right off the road and couldn't quite conceptualize the language. So I appreciate that.
I want to touch on too, I received a message about the risk for fertility issues, especially if there was a pregnancy loss. And that again, this is another area where there is a significant impact on that non-birthing parent as well. But oftentimes they are the unspoken or unheard piece of that. But oftentimes, and I will even, kind of speak to personally, that when there is a difficulty in getting pregnant, that there is this feeling that you've finally arrived at what you were wanting, and so everything should be magical, and you shouldn't have any right to complain about all of the things that are not wonderful about pregnancy. And it was really a physician who said to me, just because the road to pregnancy was difficult doesn't mean that it changes any of the crappy parts of pregnancy and the birthing experience. You still get to have all of the feelings of all of this whole experience, but a lot of times, especially when there has been a pregnancy loss that has been, there's that conflicting feeling of for moms and families of, oh my goodness, like this is all I've ever wanted, and it can really increase not only the anxiety that is experienced during the pregnancy of kind of that feeling of holding your breath the whole time, and so we see a higher rate of anxiety that happens, but also depression too, of that feeling of shame and guilt of that I should feel differently. And so I'm thank you for kind of bringing that piece up to be discussed, because there is a lot of stigma when it has been a difficult journey, or there's been a loss when the pregnancy and birthing experience do happen.
And I think kind of going off of the stigma and the loss, I think societally we are uncomfortable with death in general, and even more so when it comes to pregnancy or infant loss. And so it's almost like there is this window of time that you can talk about it. And after that, don't talk to me about it anymore because it's uncomfortable for people outside of the parenting role, or those that experience the loss. It becomes a topic where they're not really supported. They might be supported for the first week or so, and then after that, others don't really want to talk about it anymore. So then they're experiencing that loss alone.
Have either of you had much success in helping to educate, inform or kind of do the integration that we're talking about with your medical providers, OB/GYN providers? Again, Mandy, I did hear you earlier mention, sometimes there's maybe one question that's asked, and we all know, depending on who's asking it, how the question is asked, we can get different responses. Do you have particular, advice or strategies for pulling in more, maybe the pediatricians or the OB/GYNs or surgeons, just various members of the team, because there's so many people who are present throughout the pregnancy and the birth.
I think one of the most positive changes that I am starting to see is OBGYNs being more open to receiving information and training around mental health. And I think that that is essential, not just for the perinatal period, but because oftentimes for women of a certain age, that may be their main provider as well. And so how essential that screening and comfort and having those conversations are. And so, I believe that, from what I'm hearing in multiple areas of the state is that there is more of an openness to begin having those conversations and getting that level of expertise, so that at least they are aware of the next steps for getting their patients connected. And Mandy, I don't know if you're seeing that experience as well.
Yeah, I definitely have seen that as well. I mentioned the mental health toolkit earlier that I've been using, and it's been a great resource to kind of opening that door. I had a provider the other day say, like, where'd you get this? Because it just has so many things on there that they may not know to necessarily screen for, or that are risk factors. So I think that it is becoming more widely known, and I think it's just a constant education. When I was in the NICU, there would be members that would come to me and say, well, this parent's just being really difficult. And it was just a constant process of having to educate that, this parent's not trying to be difficult. This parent has a very traumatic experience and trying to have control in any way that they can. And so just constantly and gently reframing that perspective.
I also think that as this field kind of continues to grow, we're doing a better job with these resources of having it tied to educational credits for even physicians. And so I think all of us here can speak to, that there, I mean, that there are things that we're really passionate about in getting training. But then also we become even more passionate when there are some CEUs attached to that we can use for that continuing education. And so making that a part for physicians too, to where they're getting, the educational value that they're looking for as well, from that experience, and tailoring it to their experience as prescribers too, and what they need for their daily work as well, has been, that's one of the successes that we're seeing through PSI, is that we're seeing more prescribers who are participating in the advanced training and going through the certification process.
And Megan, I don't know if you want to speak to this a little bit more, because you probably have a little bit more knowledge about it, but one thing that I thought was really cool that I didn't know that there was, is that there's actually a specific hotline that new parents can reach out to. And I just learned about that a couple months ago, and I thought that was a really cool resource.
Yes, yeah, absolutely. So there are coordinators throughout the state that can assist new parents getting connected to the resources, either through PSI or in local communities. And so when individuals go through, especially the certification process to become certified in perinatal mental health, or have even attended the training and advanced training, there's a catalog of those providers that are available through the state, so that those resource centers are able to best connect, individuals who call in. There are also, for this group too, there's a lot of really great information that is available resource-wise through PSI. Obviously, they have their training and their advanced training, but also 2020 Mom is a really great resource that I would encourage if you're just looking for a free online training of just kind of like the basics of working in perinatal mental health, and some of the things to be aware of and screening for. It's a really, really great, just kind of like free way to dip your toe in to see, is this an area where you want to kind of dig in deeper to? One of the questions I just got to was the use of antidepressants or mood stabilizers during pregnancy and post-delivery, especially with breastfeeding. That's something that I will say is the biggest misconception of pregnancy and breastfeeding period, is that mom has to go off all of her medications. The good news is that that's a pretty old school kind of thought process that is being updated, and that a lot of prescribers are becoming more comfortable in having the conversations of weighing the risks and the benefits with mom for that period, and either looking at alternative medications that may be less risky to the fetus during that period, or during breastfeeding. But really, I mean, it's that risk assessment process that should be done with mom of, is it more risky for the pregnancy for mom to be unmedicated and struggling with depression, anxiety, untreated, or taking a low risk medication that will maintain mom's mental health during the pregnancy and breastfeeding? And so that is, that's an area where there's a lot of, there's been a lot done with medications to kind of, make those medications less risky during that period. And it's that risk benefit that more physicians, thankfully, are becoming more comfortable from what I'm aware of. Mandy, maybe you're seeing something different or have other things to add with that.
I think that I have definitely seen most of the physicians I work with are pretty comfortable with it. I don't know if you have experienced this as well, but I think that I have seen personally that there seems to be more fear and yeah, I guess mostly just fear about taking it from the mom's side or the pregnant person's side, or breastfeeding, whatever the situation is. Even with the additional information, just the worry that something could happen.
Absolutely. Yeah, that and that's where I think that as much education for both sides of the risk and benefits that the providers can be having with mom during that, and that we can be comfortable following up with them as well.
I know you all mentioned some resources. I'm looking in the chat, and there's a question about mother to baby website for medication resources. Do either of you have familiarity with that or a comment on that? Or do you have a preference for a different resource?
I will say the one I'm most familiar with is from Postpartum Support International with and just their the information that's been provided there through the advanced training too. But I'm gonna definitely look into the other resource and see what I think too.
Thanks.
Melanie, did you want to say more about that? Is that something that you have enjoyed or used effectively?
Yes, I teach pre-pharmacy students and other pre-mental health professionals. And when I was pregnant, I used the Missouri Teratogen Society, and they provided very specific information about medications, because I was alarmed that I switched OBs in the middle of my pregnancy, and the drugs that were on the naughty list for one were on the acceptable list for the other, and vice versa. And I thought there has to be an answer here. And so that was helpful for me. They've undergone a lot of different changes, and now they have this website that I always suggest to my students so that they have pregnant moms or new moms that have concerns. It's a great resource. And I didn't know if there was a better one. It was just one that I found as a pregnant mom, kind of stumbled across.
I love that. Thank you for sharing that.
I know that we're getting roughly close to time, and Emily's probably going to hop on here and tell us we've got to start wrapping up here soon. At the same time, I noticed, Dr. List, your comment about Taylor Swift, and I appreciate it. I'm not super familiar with that album or that, but a lot of people do tend to get information or find meaning in popular culture. That's where a lot of conversations happen. Are you willing to say just a little bit more about that? Because again, that's where general public tends to kind of go to sometimes for information.
Yeah. Well, a little bit about me. Taylor Swift, I'm a big fan, long time. I blocked my schedule for her new concert so that I could buy tickets. So it's a little embarrassing, but my 15-year-old self is happy about that. But she just released a couple weeks ago her newest album, and one of the tracks, it's called Bigger Than the Whole Sky. And I hadn't listened to it, looked at all the lyrics, but my sister had a pregnancy loss earlier this year. And she was like, I love that song, but I can't listen to it without crying. And then I was like, oh, so I went and looked at the lyrics, and let me look at some of them real quick. But after that, I was like, what are people saying about this? And when I typed in and looked at it, it was like so many in Twitter and just everything, people talking about how it gave them the ability to they resonated with the lyrics, they resonated with the song, and then it also gave them the ability to talk about it in a way that made sense for them. And so people were sharing their stories. But I like the lyrics. You were bigger than the whole sky. You were here for more than just a short time. What could have been, what would have been, what should have been you. And so and just seeing that conversation, I thought it really, Taylor Swift is very popular. And to have her write something, sing something, share something that speaks to so many people, just, that pop culture ability to just be seen and be heard.
Thank you. I can tell there's even some emotion in talking about it. So I imagine that's probably true for many people. And I'm glad that you brought that up.
I think that it's just important, especially for, us as clinicians, but also just for people in general to like normalize having some of these conversations. And so I think it's really awesome that, and I don't know what she wrote the song about, but that, it can be interpreted in this way by so many people.
Very
I
good.
love that you
Well, no, please go ahead.
I was going to say, I love that you share that. And I'm going to do a quick plug. So Postpartum Support International, there are climbs that are hosted every year. And Columbia actually just did our first one this last year. And I believe that there will be ones kind of additional ones throughout the state happening in Missouri this year as well. But one of the really impactful pieces of that is mothers being able to share their story and the just that experience of not only the stories that are shared pretty publicly, but the one-on-one connections that are made too. And so, thank you for sharing that piece where people are able to connect with pop culture too.
Well, everyone, this is Emily with MOPA, and we're coming up on the hour. Thank you so much to our speakers, to lots of great questions and conversations in the chat and online. And so thank you so much for being a part of that. Just a quick reminder, we have a couple more events coming up November 18th. So next week, diagnosing autism spectrum disorders in adults. That's one category A credit. And again, this is free documentation for MOPA members and just a small fee for non-members, but everyone is welcome. And then again, our next roundtable, December 1st, and it's the role social determinants of health play in assessment and treatment. So please sign up for that. Please encourage your peers to come, and we will get those CEs out to you just a little bit later, hopefully yet today. Thank you everyone for being here, and a big thank you to Amanda and Kristen as well. Or Megan, excuse me, I was looking at the wrong name. Megan and Amanda, thank you both. Have a great day, everyone.
Bye, everyone.